1 kilogram of this drug has the power to kill 500,000 people, and its name is fentanyl. Fentanyl is a powerful synthetic opioid, and it's approved by the Food and Drug Administration to use as an analgesic and/or an anesthetic. It's 100 times more potent than morphine and 50 times more potent than heroin. It can either be pharmaceutically or illegally made, and the prescription name for fentanyl is Actic, Duragesic, and Sublimase. And some of the street names for fentanyl are Apache, Chinatown, or Murder 8. So, fentanyl is going to be classified as a Schedule II controlled substance in the United States. This is because it's still accepted in the medical field to treat severe pain, but it does have high potential for abuse. So, when it's prescribed, the forms of fentanyl include a shot, a patch that is put on a person's skin, or a lozenge on a stick. When it is used illegally, it can be a powder or a liquid dropped into blotter paper, liquid put into eyedroppers and nasal spray, or it can be made into pills that look like other prescription opioids or mixed with other drugs such as heroin, cocaine, methamphetamine, and MDMA. So now we're going to talk about the effects of fentanyl on the brain. So fentanyl binds to the body's opioid receptors, which are found in the areas of the brain that control pain and emotions. And they do that by blocking the pain signals and releasing a rush of dopamine, causing that intense feeling of pain relief and relaxation. With that being said, with continued use of fentanyl, the brain adapts to it and it diminishes its sensitivity, making it hard to feel pleasure from anything but that drug. Now we're going to talk about fentanyl usage and its effects. In terms of mental effects, it's going to cause a substance use disorder. It also causes depression, suicidal thoughts, difficulty in controlling impulsive behavior, and mood instability. In terms of physical effects, it causes constipation, respiratory depression, sexual problems in men, poor nutrition, irregular menstrual cycles in women, urinary retention, pupillary constriction, low blood pressure, slow pulse, and fatigue. So there's a lot of risk that you're taking when you're using fentanyl. This is because the drugs can be illegally made, meaning that you can take more than what you should be prescribed to. And also because of its high extreme potency, you have high risk for misuse and overdose death. Another thing that's concerning is that its physical dependence and addiction can occur as little as a few days. Additionally, you can increase your risk of overdose because it's mixed in with other drugs without you knowing. Also, mixing fentanyl with other alcohol can dangerously suppress your heart rate and blood pressure. And also, when you inject fentanyl with a needle, it increases your risk of tetanus, infection, and vein damage. Also, sharing needles can increase risk of hepatitis B and C, HIV, and AIDS. The biggest concern when it comes to fentanyl, though, is that overdosing. So from 2020 to 2021, overdose deaths involving synthetic opioids, fentanyl, rose 55.6% and was proven to be the cause of the increase in total drug overdose deaths. The symptoms for overdosing is going to be small, constricted, pinpoint pupils, losing consciousness, slow breathing or not breathing at all, choking, limp body, or cold and discolored skin. And most of you know the life-saving medication when it comes to overdosing on fentanyl is naloxone, also known as Narcan. And now we're going to cover some common misconceptions about fentanyl. The first one we're going to cover is the fentanyl is an additive only and you cannot get addicted to it. This is wrong because, like I stated earlier, it has one of the highest potency and the most potential for dependence compared to all of the other prescription opioids. It's such a powerful drug and so much easier to obtain. So a lot of people use it as a substitute, making it even more of a highly addicted drug. And the last but not least, treatment is impossible. This is wrong because it is possible, but it is different with every individual. Fentanyl addiction may be treated with a combination of behavioral therapy and medication for addiction treatment. Medications will help ease withdrawal symptoms, manage cravings, and even block the effects of fentanyl. Despite what you see online about those struggling with fentanyl use, overcoming fentanyl addiction is possible. If you or someone you love is struggling with fentanyl, I provided the national helpline for substance abuse here. So in the end, stay safe, and if it's not prescribed, don't decide. With your help, we can spread awareness about fentanyl and reduce the number of lives impacted by it. What is it?